Okay. Hello, everyone. Today I wanted to talk about eating disorders. This is something that my family and I are currently experiencing with one of my younger siblings. I just wanted to talk about it to raise awareness. So, the most common types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is an eating disorder characterized by an abnormally low body weight, an intense fear of gaining weight, and disordered perception of weight. And bulimia nervosa um, is defined as individuals who engage in repetitive cycles of binge eating, alternating with self-induced vomiting and or starvation. And then binge eating disorder is defined as individuals who consume large amounts of food and feel unable to stop eating. So understanding the facts about eating disorders, it's a serious mental and physical health condition that affect an estimated 28.8 million Americans. They affect people of all ages, racial, ethnic backgrounds, gender identities, sexual orientations, body shapes, ability levels, and socioeconomic status. Um, Eating disorders are associated with high rates of anxiety, depression, and mood disorders. And most importantly, a full recovery from an eating disorder is possible. So, those who have an eating disorder, some health concerns, if you go untreated, um, you can get cardiovascular diseases, oral health problems, gastrointestinal issues, seizures, brain damage, sleep issues, bone and muscle loss, and for women, it can negatively impact reproductive and maternal health outcomes. So, for communities who are affected um, by eating disorders, involves communities of color. There's barriers to proper treatment and diagnosis, often stem from systemic issues like food insecurity, stress, or trauma from racism and discrimination, and they also have a lack of access to healthcare. For children, eating disorders are increasingly in alarming rates for individuals who are younger, specifically girls, just because of social media and the perception of what a body should look like for women. And then you have the disability community. People with physical disabilities and chronic conditions may have an increased risk of developing an eating disorder. They have barriers to access and treatment and discrimination from healthcare professionals, which prevents proper diagnosis and treatment. And people with diabetes and individuals in larger bodies and pregnant and postpartum people are also at risk for eating disorders. So, if you have an eating disorder, it's important to talk to a loved one or a healthcare professional about it to get some help. It can be overwhelming and scary, but there are resources out there to help you. Um, and for those who are supporting a loved one, such as myself, my siblings, and my parents, with that one sibling, it's important to, one, do the research. Super important because eating disorders, it affects the brain and it can be very hard to differentiate the person and the disorder. So I would do your research and just be patient and show love and compassion and try and talk to that person when they are ready for it. So yeah.